Good afternoon, everyone. HIV is a dreaded virus that significantly deteriorates the quality of life of affected individuals. One of the most stigmatized clinical conditions in today's world, the main pathological process being the depletion of CD4 T cells. Ocular manifestation is usually a late presentation, but can be the primary or the only presentation, thus can implicate the prognosis of the disease. So the aim of a study is to document the various ocular manifestations in HIV/AIDS patient at a tertiary eye care center. Study was conducted between January 2014 to December 2020. Total patient included in our study was 92. Most of the patient had been diagnosed to have HIV infection and were referred to us for evaluation of their ophthalmic status. Clinical profile, demographical characteristic, ocular and systemic evaluation was done, and detailed ocular examination was done. Diagnosis was established by ELISA and Western blot method. Out of the 92 patients included, 75 patients were male. Age range between 5 years to 65 years, and most of the patients were between the age of 20 to 40 years. Visual acuity at presentation, most of the patients were having visual acuity between 6.6 and 6.12. One patient was PL denied. 74 patients were having a heterosexual mode of transmission. Blood transfusion related mode of transmission was seen in 11 patients. So out of the 92 patients included, ocular manifestations was seen in 35 cases, that is 38% of cases. 23 were male and 12 were female. Out of the various manifestations, CMV retinitis was seen most commonly in 13 patients. HIV retinopathy was the second most common manifestation seen in our case. Retinal detachment, herpes zoster, chorioretinitis, optic atrophy, progressive retinal necrosis, vitreous hemorrhage, and molluscus contagiosum were also seen. Associated systemic disorder included pulmonary tuberculosis, that was most common in our study. HIV enteropathy, oropharyngeal candidiasis were also seen. In our study, as we can see, there was a male preponderance that is comparable with the other studies. 38.6% patients were having ocular manifestation, that is also comparable with the other studies where ocular manifestation ranged from 40 to 66%. CMV retinitis was the most common presentation. 14.13% were having CMV retinitis and 7.6% patients were having HIV retinopathy. This is comparable with the Vishwas et al. Study, but when we compare this with older studies like Evan et al. And Jabs et al. Study done in Kenya and USA, we found that HIV retinopathy is more common than CMV retinitis. So in our study, 38% of patients were having ocular involvement, with the most common age group was between 21 to 40 years. Heterosexual mode of transmission was the most common mode of transmission, and there was a male preponderance noted. CMV retinitis was the most common presentation. So to conclude, the clinical profile of HIV-associated uveitis has undergone a drastic change with the advent of the antiretroviral therapy and immune reconstitution. Profile and prognosis of HIV-associated uveitis will undergo further changes in the future as new treatment and finally a cure becomes available. Thank you.